here to talk to you about your horse's health. So these are the topics that we're going to cover. We're going to kind of go through kind of the highlights in these areas, kind of hitting the highlights. We can go through, if anyone's interested in afterwards, more detail. I'll be around and we can chat further. So today is about trying to provide you guys with some of the information that we get through veterinary medicine, through the research that we do, either worldwide, internationally, or right here at home. As Shannon mentioned, we work closely with the UFC, and that's a really exciting opportunity for us to be part of projects, for your horses to be part of projects, and for us to learn more specifically about what's going on in our own backyard. A lot of these conditions and diseases are described and studied in different areas of the world. A lot of times that applies to us here, and sometimes there's some specific differences in our areas that we want to look into so that we can tailor treatment to what's most appropriate for your horse. So we're going to go over some GI tract ulceration information, mostly stomach and colon ulcers. We'll also cover parasites, which are definitely a major thing that all of our horses deal with at all stages throughout their life. So we'd like to go through that. We'll give you an update on some infectious diseases that we like to keep track of here in Alberta, some that you may be familiar with, some that you may not be aware of, and kind of what's been happening in the past couple of years with those conditions. And then we'll also go over some of the research projects that we've been doing here at Equine. So starting off with gastric ulceration. In the past year, we've had a new study come out about omeprazole. So some of you may have your horses on omeprazole, maybe on GastroGuard, which is the brand name of omeprazole. It is, sometimes an expensive treatment. We've actually been able to get some new pricing on it, so that's really good news. So you'll see that in the future here, actually implemented now, but going forward. So we definitely want to get the most bang for our buck with this medication. Sometimes we might be using it during times of stress, or if we're doing a full course treatment for a horse with ulcers that we've seen on a scope, we may be treating for a month. And other times intermittently throughout training, showing, and traveling. So in this study, they compared the absorption of this drug through blood sampling, looking at the drug in the blood, and looking at the pH of the stomach. And they found that horses on continuous diets, so eating all the time, didn't seem to absorb as much omeprazole as the horses that were meal fed, and they were kind of getting omeprazole on an empty stomach. So some further research needs to be done on this, but one of the suggestions from that study was that it may be wise to give omeprazole kind of on an empty stomach, or as close to an empty stomach as we can get. Obviously with horses, this is a bit of a challenge, and part of the treatment for gastric ulcers is often to have continuous feeding. So I think if your horse is being fed maybe 3-4 times a day, they last get fed late at night and they're waiting for their morning hay, a good time to give that would be, say, an hour before their morning hay, and you may get increased absorption. Another option would be, if they're being fed throughout the day, trying to time administration in between feedings. Definitely we think about ulcers in show horses, in adult horses, but for sure weaning can be a time that we can also be dealing with stomach ulcers, both in the upper part of the stomach, the non-glandular, and in the lower part of the stomach, which is the glandular area. Those guys are going through a period of psychological stress, physical stress, changes in diet, and they may also be dealing with parasitism. That's another time. So, and it may be infectious respiratory diseases. So that can be a hard time for them. So definitely don't hesitate to, if you think something's up, have us come out and take a look. Try to use low stress weaning techniques, and in some cases we may actually need to treat them with some omeprazole. One thing that we've known for a while and has actually been repeated in a couple of different studies, but I think doesn't often get discussed, or maybe people that I talk to aren't aware of it, Well, one thing would be grazing or having frequent access to pasture. That's one of the best management scenarios, and it's not always a practical management scenario. With that, what we're getting is increased saliva production, and saliva helps to buffer the acid in the stomach, and that's one of the ways in which frequent feeding or continuous grazing is part of ulcer treatment and prevention. Another one would be to include some alfalfa hay in the diet. So alfalfa is high in protein and calcium, and that acts as a buffer for stomach acid. If you are making any diet changes, you want to do them slowly. Maybe you'll go for an alfalfa Timothy mix. It doesn't have to be straight alfalfa, in which case we'll probably get some diarrhea or a gas colic. But in these studies, which it's been repeated from multiple different groups, they've found that there is a protective effect in diets that contain alfalfa versus just grass hay diets. Another easy thing to add on, and may also work well if you have a horse in a low body condition or you want to add some extra fat to the diet, is to add oil. It's fairly inexpensive and easy to do. Some horses don't like the taste of it. We often want to mix it in with something else. We want to start with a low amount, maybe a quarter cup a day. They actually take a couple weeks to adapt to absorb higher amounts of oil, so we want to increase it slowly over a couple weeks, and they can actually absorb up to a cup a day. With oil, we want ones that are high in linoleic acid, so corn oil as well as sunflower oil are good choices there. Canola oil is a little bit lower in linoleic acid, so probably corn oil or sunflower oil. And you can always talk to your vet if you're thinking of adding this into your horse's diet and go over a plan with them. There's some photos here of different severities of gastric ulcers. Obviously, these ones here are quite severe. They may cause weight loss, colic signs. Ulcers are tricky because sometimes the signs are vague or they're very subtle, or they may have no signs at all. I know Dr. Leggett did some endoscopies on some of the teaching herd at UFC. They're kind of fat, happy, sassy horses that get to graze. They're not too stressed out, and about half of them did show some ulcer changes. So we do know, and I think probably in some of those cases, if they're doing fine, do we even need to treat it? I think if we're going to be putting that horse maybe on some non-steroidals, which Matt is going to talk to you about later, about pain control, we would probably want to know if we already have pre-existing ulcers, given that in some horses, ulcers can be a side effect of non-steroidals. So in that way, it may be good to know about, or possibly during a period of stress, those ulcers may get worse. So in summary, some horses show symptoms from stomach ulcers, other ones may be subtle or no symptoms. So moving on to kind of something new we've been doing around the clinic. We have a GI camera study that's been done on a few cases with Dr. Leggett. The company that provides this camera is called AliCam, or AliCam. It was originally, or the company that provides this camera, they've developed it as a diagnostic test in dogs. In horses, we're trying to see if it's useful, what kind of information we can get. I think it's really fascinating. It really reminds me of this show, if you ever saw it growing up, where they go inside and drive the school bus around and get to see internally what's going on. So I think this is a really neat tool. Some cases in which we may use it would be horses with low blood proteins. So sometimes if we have ulcers somewhere in the GI tract, we get loss of a blood protein through that. We can also lose blood through that. If we have a bleeding ulcer, we may have an anemia. Other times, if there's a problem with the intestines where they're not absorbing protein, then we may have low protein because there's a problem with absorption. It may be most useful in cases of small intestinal lesions. The large intestine and the cecum is quite big and has a lot of feed material in it, even in a fasted situation. So it's hard to get the camera right up next to the wall to take a look, but we do get some images from those areas. These images are from small intestine, and the camera gets up nice and close. This is the camera here, it's nice and small. We give it to the horse with a nasogastric tube. We get to measure transit time, and we know where it is throughout the GI tract, and then we collect it afterwards. And then the camera is sent in to the company, and they read these images and provide a report in conjunction with our interpretations. So these images are from the small intestine, and we can see some erosions on the wall of the mucosa. So stay tuned for more information on this camera study, but it's a very interesting new technology. So I'd like to talk about parasites. Some things are the same, some things are changing. Parasites especially, I think overall have been changing. Their response to dewormers has been changing. The types of parasites we see and the prevalence changes as well. So these are the main categories of parasites that we need to worry about. Small strongyles, which is where most of the focus has been recently. They tend to hide out sometimes in the colon wall and inside the lumen of the intestines, or where the feed material is. The second one is large strongyles. These are also called bloodworms. Tapeworms is the third one. Pinworms, which are the ones that cause an itchy tail, are also there. And then ascarids. Those tend to be mostly a foal issue. Sometimes adults can get ascarids. So starting with small strongyles, we're still dealing with resistance issues, and we'll talk about how do we know there's resistance, what do I do about resistance on the next slide. Large strongyles, for the most part, have mostly been eradicated in the past 20-30 years in closed herd situations. And so they're not talked about too much. We have found in the past year or two, possibly an increased number of cases of horses with large strongyles. The concerning part about large strongyles is that they tend to cause a lot of damage compared to any of the other parasites, and they are probably the most likely parasite to be fatal. This happens because they have a different life cycle than the other parasites. They migrate through the blood vessels that supply the intestine, and while those larvae migrate through, they cause blood clots and damage to the artery walls. Once we have this severe of damage inside of the artery, we often have that associated part of the bowel lacking blood supply. That piece of bowel can die off. We have colic, and unfortunately it can be a fatal scenario. The other problem, or another issue with it, is sometimes we only find out about this once this irreversible damage has already occurred. So this is one we definitely want to monitor. There are some blood tests that we can do for this parasite through Kentucky, and we're working on developing that. Otherwise, they are a little bit hard to diagnose because the eggs look the same as small strongyle eggs. So if anyone wants to talk to me further about testing and monitoring for this parasite, I'd be happy to chat about that afterwards. For tapeworms, as long as you're using praziquantel in the fall, so something like Quest Plus or Equine Gold, those are plus praziquantel, you should not have too much of a problem with tapeworms. As of now, we don't seem to see too much of a problem or colics associated with tapeworms in this area. And the recommendation when you have low numbers of tapeworms for adequate control is just to use praziquantel once, maybe twice a year, but once a year, and the fall is the best time based on their life cycle. For pinworms, they're usually sensitive just to ivermectin, but we do have documented reports of resistance, and you may experience that yourself. You deworm your horse, and she or he still seems itchy. So in that case, you may want to consult with us, and we can try to develop an appropriate worming schedule. Ascarids, or full roundworms, these are the ones that look like long white spaghetti, are definitely still an issue. They're mostly a problem because, first of all, if we're not worming properly, we really need to start worming in about the first 8 to 10 weeks of the horse's life, and then continue every 8 to 10 weeks afterwards. I've actually was talking to Angie Benson, our South Clinic manager, who gets a lot of questions, maybe after foals go home, after foaling out at the South Clinic, or just generally people who have foals, on care, monitoring, vaccines, and deworming. And so I'm going to put together an info sheet that's going to have all of this information on it. So we'll go over it, but I can make that available on the website just to give you a summary of looking after these guys in the first year, because they do require a little bit more intensive management. So we don't want to not worm the foal and then worm him when he's a year, or even a weanling. He has a lot of ascarids and he gets an impaction. We've talked about that in some other of our client seminars. The other scenario that we have is people are worming their foals, but they're not killing the ascarids properly. That may be because it's not the right kind of dewormer, or because that dewormer, those parasites are resistant to the dewormer. So we've seen both. So we've had a weanling come in. The weanling had a pneumonia. She was being dewormed with ivermectin starting when she was 2 months old, every 8 to 10 weeks. She'd been rotated through wormers, but they were all ivermectin. And she actually had an egg count of roundworms of 2,000. So that's pretty high. Over 500 is generally considered high. So they were being wormed. They were being wormed with the right frequency, but it wasn't the right kind of wormer in that case. So in that case, we did some treatment with Panicure or fenbendazole, and we were able to successfully kill these worms, and we didn't have an impaction. We treated the pneumonia, and everything was good. On the reverse side, I've also had a weanling that's had lethargy, swelling on his ventral abdomen, low protein, so they often get the swelling when they have low protein. May have been dealing with some ulcers in this particular weanling, but we did an egg count, and this weanling was being dewormed according to recommendations with Panicure, which targets these guys. But this weanling was in a paddock with some older horses, yearlings, that weren't being wormed very much, and that older horse was shedding more of these adult worms, and the weanling had a high count of actually strongyles, so we needed to change the type of wormer that we were using to target those worms. And that brings us into when to do fecal egg counts and how to tell what kind of worms we need to target. So you can kind of do them anytime. You can check them in the spring or the fall. Either they've been dewormed a while ago or they're coming up for worming in a bit, just to find out if they're low, medium, or high shedders. Low shedders have good natural immunity. High shedders can't fight off parasites very well. They need to be dewormed more often. A good time as well to do it is ideally before and after deworming, but if you've just dewormed and you want to find out, did we kill all the worms, you can bring in a sample 2 weeks later. That will give us our fecal egg count reduction, again, ideally from a pre and post-worming sample. If we have over 95% reduction, we say those parasites are sensitive to that wormer, and we're not worried about resistance. Weanlings, maybe in the age of 6 to 8 months even, depending on when you wean, but when they're in the age of 6 to 8 months, doing a first fecal egg count is a good time to find out, am I dealing with those spaghetti roundworms and I need to do fenbendazole, or am I starting to get strongyles and we need to maybe do ivermectin. I was at a presentation in Florida at the AAP, and Dr. Nielsen, who's a parasitologist, presented this new technology that he's developed. It's actually a smartphone app that allows us to do on-farm fecal egg counts. There's a fluorescent antibody that's added to the manure, and within 10 minutes, we have a screen that displays all of the eggs. They all light up, and it does a count for us. And the counts are very accurate, possibly increased accuracy compared to manual when they measure multiple times. So it seems kind of cool. We'll see if it comes down the pipeline. It's supposed to come out this fall. We'll see about the availability and the practicality of it, but it's really neat that people are working on new technologies for parasite surveillance. More on fecal egg counts, how often. Most horses need a couple. We determine if they're low, medium, or high shedders, and then we can plan how to worm them. That being said, if something changes with the horse's health status or where he's housed, his parasite exposure and his ability to kill parasites himself may change dramatically, and we want to recheck the egg counts. We can't just use the same worming program throughout their whole life. I think you guys want to follow worming programs. Sometimes it's a matter of not getting the information across. Other times we get the information across, but because it's actually pretty complicated to treat worms properly and things are changing, we can't make blanket recommendations for everyone, and it's hard for people to know what program they should be on and how to follow it. So again, I'm happy to talk to you guys about on an individual basis and provide some guidance, and we will have a document together on deworming foals. So if we have a change in housing, maybe there's more stocking density, maybe your horse was in a stall or in a paddock by himself, and now he's going to be going out into a group paddock, or he's on pasture, or he's going to be around some younger horses or some older horses that may be high shedders. He may have more exposure. That would be a time to recheck the fecals. Another instance would be in an older horse. If we're dealing with Cushing's, they may have higher shedding, need to be dewormed more frequently. And then other times, if the horse seems to be showing some signs that could be associated with parasites. Some horses don't show any signs and they have really high parasite loads. Other times we might see things like weight loss, diarrhea, colic, which are non-specific signs that can be caused by other things. But in some cases, parasites can cause this. Just wanted to talk quickly about ticks. We've been seeing, which are a type of parasite, they're an external parasite, possibly seeing more ticks, more tick infestations on horses. Recently, definitely there's some reports of just more ticks in general being found throughout southern Canada and kind of spreading west. And so I want to talk about what to do about them and how concerned we need to be about it. So Lyme disease for sure comes to mind. The good news is we don't generally have this kind of tick in Western Canada, Ixodes scapularis. That's also called the deer tick. They're very small, so maybe they are around, but it's difficult to find them, to send them to submit. They have been found on dogs, and I think there were 17 cases that cultured positive or tested positive for Lyme disease on dogs in Alberta last year. The dogs hadn't been traveling. They presumably got these ticks in Alberta, so there may be this kind of tick in Alberta, but as of now, its distribution is considered to be mostly eastern. If your horse is traveling, this might be something that's relevant. It's definitely a big deal in the northeastern states. The more common one that you may see is this guy. It's called the moose tick or the winter tick, and it doesn't have the ability to carry the bacteria that cause Lyme disease. So overall, it's not really a disease we see in this area or have to worry too much about. But in order to monitor that, there is actually a free submission program through Edmonton, where if you find ticks, remove them. There's some instructions on removing ticks here. We're also going to post this PowerPoint on the website, so all of the websites that show up here, you won't have to worry about writing down. You can go look them up. So we can send the ticks in, we can get them identified, you know which kind it is, and they'll test them for Lyme disease if it's indicated. As far as just controlling them, definitely when we see them on horses, they can cause some itchiness, maybe some oozing of the skin, a poor hair coat, in a severe case, an anemia because they're sucking a lot of blood. So there's some instructions on really detailed everything you need to know, pregnant, non-pregnant, young, old horses for treating. But in general, oral ivermectin does kill them. The ticks need to have a blood feed, so we identified some on a horse, but they were all immature stage. The horse had just been dewormed a month ago. Why does he have ticks? They're all immature, they haven't been blood feeding yet maybe, and they haven't been killed yet. So I would do it in conjunction with something topical, like dusting powder, and you can repeat that in 2 weeks. And then the other recommendation is products containing permethrins. Just to touch base on some of the infectious diseases that we may think about in our area. The first one is West Nile. The second would be equine infectious anemia, which is what we test for when we do Coggins. And then the other one is equine herpes virus. So for West Nile, this data is available on the Government of Alberta website. So you guys can look this information up as well if you want to know what's out there. Should I be concerned? Sometimes I discuss with people, should I vaccinate my horse, should I not? I think thinking about how common the disease is helps us decide if we should vaccinate. Thinking about possible side effects of the vaccination and how effective the vaccine is. This vaccine is almost 100% effective. It's a very effective vaccine. And the disease, unfortunately, when it does happen, can be quite severe. So in that case, a lot of people would elect to vaccinate. But just so you know, the overall prevalence in 2015, we had 10 cases in Alberta. In 2016, we also had 10. The location of the cases is listed here. And this is all available online because it's a reportable disease that our government monitors. So not every disease is recorded and posted in this way, but for these diseases, you can access that information. So as you can see with West Nile, when it kind of first came about, we had a spike in 2003. We kind of had another peak in 2007, and then a small peak in 2013. So this can be typical of a new disease that comes into an area. We get the epidemic spike where we have a lot of cases, and then after we get endemic cycles where some years we have a few more, some years a few less, some years a few more. So that may be the pattern that we're in right now with this disease. It's amplified in birds, so it can be carried here by birds. It usually takes until the fall, until the amplification in birds is high enough to transmit to your horse. So yeah, there's mosquitoes out in May. Oh my gosh, my horse might get West Nile. In general, the viral levels aren't high enough to cause infection at that time. So we do recommend vaccinating in the summer so that you can have high antibody titers to protect your horse in the fall when a bite with a mosquito carrying the virus could cause disease. There's no transmission from horse to horse because they don't amplify the virus enough to be viremic enough to transmit if a mosquito bites one horse and bites another, to our knowledge at this time. And the same thing with humans. They're kind of similar, and we don't have horse to human transmission. For equine infectious anemia, which is what we test with Coggins, you may wonder, why do I always have to do Coggins? It's always negative. It's just something that a show requires or the border requires. But we do have some cases of it that pop up. So in 2015, we actually had 31 cases in Alberta. A lot of that was associated with this northern region, but you can see that we did have some local. As well in 2015, we had an outbreak in Saskatchewan, in northern Saskatchewan, and some cases in BC. Same thing with 2016, we had cases in Saskatchewan, none in Alberta, and one in BC. So if you're getting a horse, maybe on a pre-purchase from an area like this, somewhere in the northern provinces, or just in general, you might consider running this test in a pre-purchase scenario, just because there are implications for quarantine if the horse does have a positive test, or if you're traveling to an area that may have a history of having cases of this. It is transmitted, it's a bloodborne disease transmitted by biting blood-sucking insects and by needles if you're sharing needles, which we don't ever want to do anyway, but always just make sure, even if you're using a multi-dose vial and drawing up, say for multi-dose Legend or a multi-dose vaccine vial, make sure to change your needle each time. If you are traveling with your horse and you want to know if there's any additional diseases you should be concerned about prior to travel, then feel free to talk to one of us. So for equine herpes virus, this is the one that was getting a lot of attention and still is definitely on our minds. This is the one that caused the outbreak in the States with a lot of neurologic horses in a show type of scenario. Just some facts about it. We have two types. We have the natural or wild type equine herpes virus 1, That one is associated with neurologic disease about 10% of the time. And then we have this mutated form, so it's the same virus, but it has a small genetic mutation in it that seems to make it more likely to attack the nervous system. And that one, in outbreak situations, can have a 90% chance of causing neurologic signs. We do monitor this in Alberta. We haven't had any cases of this mutated form, the one that tends to spread really quickly and causes neurologic signs, in Alberta in 2015 or 16. There was a case in Alberta in October of 2016, and we had some people calling in to the Alberta Veterinary Medical Association concerned that they've heard that this disease might be present, and they were able to confirm it was a wild type, not the one that has a high propensity for affecting many horses to cause neurologic signs. I'll just tell a quick little story. If the client who told me this story is here, I hope she doesn't mind, because I thought it was a cute story. I was out to vaccinate this fall, and I had a question from her. I heard there's something going around in the horses that can cause, some swelling, some respiratory signs. And so I asked her, what did you hear? What kind of disease did you hear is going around? And she said, tuberculosis. And at this time, we had the bovine tuberculosis outbreak, and then we possibly also had some concern, maybe she had heard of this, maybe she hadn't, about respiratory signs from herpes virus. So that to me was an example of how there is information out there, and there can be a lot of good information online. We need to make sure to check the right sources before we jump to conclusions, and also to check with us as well. We can often answer a lot of questions about that, so that we can act appropriately rather than just based on hearsay or on unconfirmed information. Testing is fairly easy. Sometimes you have respiratory signs at your barn. You're just gonna do some antibiotics or Banamine and kind of isolate the horses, and you'll do it that way. Other times, it can be really helpful just to do a quick swab. This particular EHV we can test with a nasal swab, and we also sometimes submit a blood sample. So, how does vaccination fit into this? So the current recommendation is to still vaccinate for equine herpes virus. In some horses that are in high exposure situations or showing a lot, or if they're FEI, they're required every 6 months. Otherwise, for lower risk horses, we can go once a year. Vaccination cannot, it's not labeled to prevent or guarantee against neurologic signs. So you would wonder, well, should I still vaccinate? Do I need to still vaccinate? And the recommendation is that the vaccine reduces nasal shedding, so it reduces the spread of this disease. And we still highly recommend that you do vaccinate in order to help control this disease and control the spread. This is a really good website from the ABVMA, how to have biosecurity guidelines in place for horse events. If you're an event organizer, I would highly recommend looking at it. The link is here. And then there's also just barn biosecurity guidelines if you're running a barn and you want to know what you need to be looking for and how to implement these procedures. The other one would be on an individual basis, how to have biosecurity and to protect your horse in high exposure scenarios. So if we're having nose-to-nose contact at shows, lots of new horses mixing, horses traveling, horses that may be stressed and shedding something, we can protect ourselves by following some of these guidelines. We can take temperatures each day. Sometimes a fever is one of the first things that we might see. And also watching for any nasal secretions and calling a vet to have your horse examined should you see any of these signs at a show. Another fun thing that we've got going on now at the clinic is a handheld reader for serum amyloid A. This is a blood test for a protein that's increased in cases of inflammation. It's very quick to increase, and we can detect increases quite easily, so it's sensitive. It's most useful for respiratory diseases, so maybe we're trying to decide if something is more allergies or if there could be a pneumonia or an infection, bacteria or virus. It's a blood test, and we can do it at the farm usually. Sometimes we take it back to the clinic and have information quickly. It takes 10 minutes to run. It may also be used to monitor response to treatment, and there's some research being done to validate how to look at this blood test in evaluating septic foals. So they may be a bit not quite right, and we're not sure, are they septic, which means they have bacteria in their blood, they need antibiotics, or do we not need antibiotics? So that's a nice application. So lastly, we'll just go over some of the fun research stuff that we've been doing here at the clinic. I dug up this picture of Erin, and she's not here, so she's not going to get mad at me for it. This is when she was a student, I think, when she graduated. So yeah, Dr. Shields, Erin, who Chris mentioned before, she has worked with Dr. Leggett on this study, which is measuring a breakdown product released from the heart when there's heart disease. So they looked at a new, more sensitive test for cardiac troponin to validate it for monitoring for heart disease. So maybe monensin toxicity or a bacterial infection on the heart valves, heart failure, those kinds of things. Luckily, we don't have too many cases of heart issues with horses, but there are some cases in which this test is very valuable for assessing damage to the heart. We have a foal diarrhea study going on again this year with Dr. Whitehead, which I'll mention on the next slide, just so you're aware of it. Dr. Marie France did a really great study taking blood samples from some of our critically ill horses in isolation. So this was done through the UFC, but the samples were collected from owners who were consenting to have their horses participate in this study. And Renaud tells me that they gained some really good information from the study and their understanding of equine sepsis. The camera study we talked about before. And then Heidi, Dr. Bance, has a study going on this summer on metabolic syndrome. So this is just a summary of some problems, obviously, that diarrhea causes in foals, some of the signs that you might see. Sometimes it's hard to tell, is this just a little bit of loose manure? Is this a bad diarrhea? Is my foal really sick? Is it a full heat diarrhea? So we'll try to address monitoring for that on our full fact sheet, but always feel free to call and talk to one of us, and we can determine if your foal needs to be seen or not. So some of the agents that can do this in young foals, E. coli, sometimes one of the main ones of concern is Clostridium, and that's actually what this study is on. So Dr. Whitehead wants to get specific information on diarrhea in foals in our area. We isolate a lot of the same things that are reported in other studies, but we want to find out more specifically what are the characteristics of Clostridium causing diarrhea in foals in Alberta, because we seem to have quite a lot of it here. So these are the objectives of the study, which we talked about. We're looking for foals that are sick, that have diarrhea, less than 30 days old, that come to the North Clinic, and then also just foals that are tagging along with the mare who's coming in, or they're there for something orthopedic, just so that we can compare sick foals with normal foals. So the interns will probably go over this with you if you come in, or you can inquire about it. There's just some paperwork to fill out. Then we freeze the samples and batch test them. We're going to get blood and manure from the foals, blood, manure, milk, and teat swabs from the mares. One interesting finding that's kind of come out already from the work that was done last year from Dr. Whitehead that she's really interested in is that she's been isolating Clostridium perfringens from the teats of mares in both mares with healthy and with sick foals. So we have to find out the significance of this, but one thing that she's that's suggested is that the teats may be a source of exposure of Clostridium, which is a bacterial spore, a source of exposure to the foal. So the recommendation currently, and will be studied further, is to do a wash of the udder before nursing, and that may help reduce transmission to the foal and just ensure that the teats are clean, maybe just by wiping with some water. If the mare lays down and some manure contacts her udder, that's where the clostridial spores are, is in the manure. So this might be a route of exposure. Other times they just get it from nibbling on stuff in their stall, buckets, door handles. So disinfecting everything before foaling using something soapy, and then after doing Virkon to disinfect is a good idea in between foals, and especially if you have a sick foal, following disinfection and biosecurity if you have a foal with diarrhea. Dr. Bance's metabolic syndrome study this summer, if you want to approach us about it, or she might be, we can send out an email or something. She's looking for horses that are overweight or obese, and she's looking at doing an oral sugar tolerance test with them to validate a type of sugar that's available here in Canada compared to the Caro syrup test, which is used in the States. So we basically get the opportunity, if you're participating, to find out what your horse's insulin metabolism is, or what their glucose metabolism is like, and what their insulin response is like. So that will be a good one to look forward to. I just put this together quickly. It'll be posted up on the website as well. The internet can be a good source of information if you look at the right sources. So the AAEP, which is kind of provides a guideline to the industry overall for both veterinarians and owners, has an owner-specific section which you can go to. This, if you've ever read articles from thehorse.com, is a good source of information. The articles are concise, they go through the scientific information, but also what you need to know, and it's sponsored by the AAP, so the information there is really good. So if your horse comes to the clinic, he has colitis, that's really complicated. You know, I don't understand half of the things that they're talking to me about, some of the terms. Always feel free to ask. We want to talk to you about it and have you feeling comfortable with it. But you can also go on that website and just read about it and say, okay, yeah, they talked about this, or this makes more sense to me. The Alberta Agriculture website is going to have those numbers on some of those diseases that we're going to monitor and notifications, same with the CFIA, also some stuff about import-export. Megan in our office is a great resource for that. This website has really good information on pastures and monitoring toxicities and descriptions of kind of pasture-associated issues that you may have. So I use this one. They just have all the information right there if you're concerned about that, and even stuff on pasture management and that kind of thing. Equine Canada is also a good website to go to. I just put this link up for drug regulations. So in regards to showing, if you want to find out about medications in regards to showing, talk to us, and also this website will have everything on there for you. And of course, at any point, please talk to us. So thank you. This photo is taken by Rochelle, our receptionist, as well as some of the other photos in here. She's an excellent photographer, so I thank her for the photo credit.